Hey guys, so I'm just kind of doing an update. I'm really not a happy camper. I know I look like crap. I just woke up not too long ago. But I decided to make a video because I wanted to do an update and I kind of wanted to have like a venting or like bitch session, I guess, on here. Um, so I just had my appointment with my neurologist not too long ago, and he gave me the bad news of I had my EEG where I stayed in the hospital for 3 days. I was hooked up to all the stuff. And I was having seizures during it so they could monitor and they could, check what was going on. And the outcome is he told me at my appointment that he thinks that where the location is at, which it's on the left side, is that it would definitely interfere with vision, motor skills, speech. And he thinks that it's a really bad idea, I guess. So I'm pretty pissed off and like pretty bummed. But he says if I want to, that I can still go on with further testing um, to just like double check and make sure. And I think I'm going to go ahead and go forth and do the further testing because, I mean, you never know. Maybe I have a chance to like get the surgery done and maybe it's not really in the location that he thought. I mean, I trust my neurologist because he's been doing this for years, over 20 years. But I was really looking forward to this. I was really looking forward to like a stop and ending and everything. So, but I can't do the testing yet because the testing is so expensive. The EEG alone was just $800. And I'm paying what I can on it, but then again, I've got pills to pay for too. So, I qualified for Medicaid in 2013. So I think I'll wait to get testing done next year. So in the meantime, I continue to take medication and um, just deal with it, I guess. But I've been really pissed off because my doctor, he upped me on my Lyrica, and I already told him I was having suicidal tendencies pretty bad. And he just kept saying, okay, we'll keep on watching and making sure and seeing like, how often you're having those thoughts. I'm a happy person, I really am, but those thoughts creep up on me and they just pop in my head. Like I cannot control it and I'm having a hard time. I mean, this is what I have to deal with. All of the stuff in here. And I did research, one of these. Side effects, depression, anxiety, suicidal tendencies. Um, these don't. Which that one was Tegretol. And then Lexapro is supposed to make you happy. One of those things, of course, depression, anxiety, suicidal tendencies. Let's see. There's the Lyrica. Lyrica, he just upped me on 200 milligrams at night, 200 milligrams in the morning, which this one also, depression, anxiety, suicidal tendencies. Which I told you, like I've discussed this with my neurologist, I have discussed it with my therapist, and I'm telling them, like, look, I'm having problems and complications. Like, I don't want to be on this stuff anymore. I'm so sick and tired of taking medication. I mean, there's so many. There's many. Respiridol, trazodone. There's just a lot. A lot. Look, that's not even filled up. All of that crap. So, like I say, I continue to pay for all this stuff, and like one bottle alone will cost me $100 or plus $100. That's just one for 1 month. And you've got some that are like $60. You've got some that are like $40. I only work part-time right now because I'm on disability. So I'm having a hard time with all of this stuff. Like, it's really, really difficult. And it's hard, like, for example, this week I work only Monday and Friday. So Tuesday, Wednesday, Thursday, I'm sitting here by myself, bored, pretty alone, and upset. You know, I can't go out because I can't drive. I mean, I'm not trying to make this like a whole like pity party type thing. I just have to get it like out. I need to vent. I need to get it out. I need to get it out of my system because I'm just really pissed off and I'm upset. I don't know. It's bad, and I don't know what to do now because I want to get off all this stuff because it's making me feel crazy. It's making me feel I'm just scared. I'm scared to be by myself because I'm scared of like the things that cross my mind, and it upsets me like really, really bad. But I'm sure some other, some of you guys have probably had the same thing with stupid side effects, and it's just I can ask my doctor to take me off of it, which I have an appointment coming up soon in March, and I'm sure I will be like, take me off of this stuff. I can't do this, It's really, really upsetting me. And it's making it hard. And I've been trying to be as happy as I can, like around like in public and stuff, but whenever I finally get home, I'm tired. I'm tired of trying to like smile and be okay. But I don't know, I just feel like I can't do this. There's personal stuff going on. And then all this stuff on top of it just makes it hard. It makes it really, really difficult, and I don't know. So if any of you are having the same things with like any of the pills, I'm talking, like I said, I've been, my therapist says write in a journal. I've been writing in my journal. I've got pages filled, which tries to help me. I've been doing research on my medication, on the surgery, and like I said, I don't know. There it is right there. Which says Tegretol. But you guys probably can't see it. I may have to. Tegretol, depression, anxiety, suicide. Lyrica, depression, suicide. Lexapro, depression, suicide. Trazodone, depression, anxiety. And I'm having all of these things really, 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 really bad. And I talked to my husband about it. I talked to friends about it a little bit. I don't go into detail too much because I don't want to scare them really bad. But it sucks, and I need to do something about it. I need to figure out how to fix this. So I just had to make this video to vent. Some of these videos, I'm sure people don't watch, and I sometimes I don't care because it's just a way for me to release. It's for strangers, to just look at it and be like, okay, I'm having the same feelings as you are, And it makes me feel better that I'm not alone when people comment and they're saying, oh, I'm having the same thing. It makes me feel like I'm not alone and that I'm not crazy. So, I guess that's it. I just needed to do a little bit of a video therapy, I guess you could say. And I will talk to all of you later. Have a wonderful day. I just needed to vent, and thank you very much. So, I will be hopefully better, and I'll do an update next time after my next appointment, and hopefully the next appointment goes really well. So, love to all. Mwah. I'm out.